Thank you, Sahani sir. Thank you. Sumana madam, please unmute yourself and talk.
Please, Sumana ji, please unmute yourself.
Okay, okay.
Yeah.
Thank you. Namaste, sir. And thank you, Dr. Anjali, for a nice introduction of me. And I am at the outset, I am very much thankful to all the team of IFPH, the organizers, the students, the homeo lovers. So everyone, a very, very good evening. So yesterday, really, I had a Hindi session on dysentery-co-compound bowel nosode, and really I talked many more things on that. Recording was in problem, but still then I had discussed many things about dysentery. But today's class is on psychotic compound, which has already been, I have taken this class in Hindi session about psychotic compound. So psychotic compound really long session. So I will, I think I will concentrate on psychotic compound today. Sani sir, will I go for dysentery compound yesterday's session or today, as discussed with Dr. Dhanesh previously, that the psychotic compound, what will I do today?
Okay, madam, as you wish. We can take the classes. We are continuing, no? So we can take the classes next time also. You can, you as your wish, you can take now. Okay.
Okay. Thank you.
Okay.
Thank you. So today, thank you, Dr. Dhanesh, for giving me the chance to speak in this forum. Coming to psychotic compound, I am sharing my screen. Bowel nosode psychotic compound and yesterday what I had discussed, the dysentery compound, both are very important bowel nosodes in practice. In clinical practice, in my practice, I have seen that very reliable to administer psychotic compound and also the dysentery compound. So both the drugs are very reliable. They cure very difficult chronic complex miasmatic cases. So in that's why really Morgan Gartner and Morgan Pure also very reliable. So 4-5 bowel nosodes I have seen, I have experienced in my practice that they are giving very good results. So one as a psychotic compound, we know the prototype drug where to go for bowel nosodes. Already I had discussed in introductory session that when we are finding in suppose in a chronic case, we are finding some symptoms of natrum salt, some symptoms of rostox, and some symptoms of other drugs. In those cases, we can choose some cases, so some symptoms. So we can go for 3-4 medicines. In those cases, we can think of the bowel nosode psychotic compound. Instead of going for confusion with the 3-4 drugs, we can go for the bowel nosode psychotic compound. Number one. Number two, as we know, as the prescription of nosodes are occurring, that is when a indicated remedy fails to give the satisfactory result. To some extent, it gives satisfactory result, but after that, we are finding that there is no improvement or a standstill condition is there. So in those cases, we are going for a nosode or a bowel nosode. Or in the after the standstill condition of nosode also, we can think of a bowel nosode. So bowel nosodes are very deep acting drugs. Already all these things discussed in the introductory class in a previous session. So today no need to discuss all these things. We will focus on psychotic compound.
Please unmute yourself.
Hello. I can hear you, but when she was starting with the slide
Okay,
of Tuja, we did not listen.
Okay.
I can
Yeah,
hear you.
doctor,
No
doctor,
problem.
doctor, please start. Dr. Sumana
And
Kumari.
also has to unmute now. She also has to unmute for yes, please. You have to unmute.
Please unmute, madam. I think muted by without. Please unmute yourself. I'll send you request.
Hello.
Yeah,
Now.
madam.
Hello.
Now you can speak. Okay. Now you can speak.
I can't share my screen, madam. Host disabled participant screen sharing.
Ayo. I don't know what happened. I don't know what is happening.
Same thing yesterday also happened like this.
Host tool, right? Because
Yeah.
I'm not host tool. Log meeting. Share whiteboards. Request. No. Actually not. Because I don't know what happened. I couldn't enter from my computer. So I'm through the phone. It is difficult for me. You cannot share the this one while anyone else is there? Those who have joined from the computer. Dr. Danesh, are you there? Dr. Danesh?
Screen sharing is going on.
Yeah, I made okay, I made her co-host.
I will make you as a host. Okay. Then
Yeah,
you
yeah,
can.
I shall make you again your host. Okay, okay, doctor.
No,
Yeah.
doctor. No,
Yes.
make me as a co-host.
Yeah, I made you host now.
Okay, I'll
Okay.
no need.
Now we see the
I
slide.
did her.
Now we see the slide. Yes.
Is it visible now?
Yeah,
No,
it is
no.
visible. Yeah, it is visible.
Visible?
Yeah.
Okay,
Yes.
okay. Good,
Okay.
good. So already we had discussed these things, that similar drugs like natromsol, rostox, acid nitric, antimtat, calcarea, ferromate, and basilinum. So these are the similar drugs. So before going to the content of psychotic compound, I will discuss a case which was cured with a case of infertility, secondary infertility, and the lady became fertile and with psychotic compound. Really, usually I see the infertility cases and I deal with the missed abortion, infertility, all gynecological issues. But this is my first case with bowel nosode. Okay. What I usually go for Morgan Gardner Pure, many more in arthritis cases also. I use Psychotico with very good result. But in case of infertility, this is my first case where I got success with psychotic compound. So a very interesting case really. The lady of 35 years approached for secondary infertility for last 5 years. 5 years secondary infertility in last May 2024. She has visited to my clinics. Coming to the history of present complaint, she had 2 miscarriages. First was in 7th week of gestation and second was in 9th week of gestation in last 2020. She had miscarriages. And again after that, the gynecologist advised her to refrain from conception for 6 months. So refrain from, not to plan. So 6 months. After 6 months in 2021, the couple has started planning, but they came to know in 2022 that the lady is infertility, she is not conceiving. So how that happened? Because she had 2 pregnancies, although that turned in miscarriage, but she had pregnancy. But now in 2022, she didn't conceive at all. So they went into a gynecologist to consult her why this happened. And in 2022, she was under hormone replacement therapy for many months. And after that, in 2023, also they have consulted various gynecologists, too many gynecologists, and finally in the beginning of she has undergone the diagnostic hysterolaparoscopy to know what happened, and many more treatments. So after that, in beginning of 2024, in February 2024, I will show you the documents that they came to know that the lady was suffering from polycystic ovarian disease might be due to stress, so much stress, because since last 3 years, 2 years plus, she has visited many gynecologists, spent a lot, but all in vain. And the social trauma, that is infertility people think like that. The family members, the relatives, they don't cooperate the lady for this. So they criticize they comment the lady that something wrong with you. That's why you are not conceiving. So like this, many more things, those added stress to her. This, I think, that might be the cause of polycystic ovarian disease. And another thing she found from hysterosalpingography report that both the fallopian tubes were blocked. Okay. So how that happened? They became very astonished. So she has conceived in the past. So that's why after analysis, another gynecologist lastly told her that due to the second miscarriage was the incomplete miscarriage. So, and they had gone for dilatation and curettage with a gynecologist. Might be from that OT only, or from that labor room only, she has been infected. She might be infected from those instruments. So, and after that, she is suffering from bilateral tubal block. So, how she will conceive? And again, she has to go for a cannulization of surgical procedure to conceive. But the lady and her husband didn't agree with that. They told that once we had gone to with the instruments, that now she is suffering from bilateral tubal block. Next time we will not prefer, and they came to the homeopathy and to me. So this is the background with this, and she had symptoms like menses regular, mostly not so scanty, sore mammy before and during menses, recurrent headache after miscarriage, and after that she developed headache, recurrent headache, aggravation summer, heat, aggravation from anger, thinking, thinking deeply, emotional trauma, sadness, menses during. On day one, usually she was suffering from headache, and the headache was relieved by sleep. She has occasional pain abdomen and vomiting from prawn and crab. That was very occasional because she left prawn and crab after that. Okay. So with this presenting complaint with the physical generals, I found she has thin physical constitution. The lady was anemic. Her BMI was 19.5. So that's quite normal. She was not obese. Okay. Hot patient, aversion to milk and sweat, increased aggravation from excitement. Coming to the mental generals, I told you that the She was from a joint family, and she was the only daughter-in-law of the house. Her husband was the only son of his parents. So with this condition, she was going through much more stress, much more stress. She was going through much more stress, and but as a daughter-in-law, she couldn't say anything. She couldn't answer. She has no courage to answer anyone that this is not my fault. So she had no courage. Only she has to bear those things. So there was a suppressed anger, suppressed emotions, which was reflected in PCOD condition. Okay, so very sensitive to criticisms, but unable to answer anyone. She was very fearful. She is not so independent, so not so modernized. She was very coward. I have taken the rubric cowardice. Can't place her opinion before others. She's complaintless, though suffering a lot, but couldn't complain anything to anyone. That this couldn't state that this is not my fault. Why are you commenting me? She has never told like this. Okay. So I am very much depressed, very nervous, fear of strangers, fears to reply, and caring weeps on admonition. She was weeping on admonition. Okay. So these were the mental symptoms, and this is the family condition. So in this condition, she was also very much depressed that as a only son of the family, she couldn't give any child to her in-laws. So they were very much stressed. All the relatives were saying to her that all the neighbors. So she was fear of strangers. Gradually she developed that this fear, why they will come. If they will come again, they will ask me. They will tell me that this is your fault. So that's like that. Okay. So coming to past history and family history, past history, skin disease in childhood, recurrent dysentery, recurrent miscarriage. And in family history, father had diabetes, grandfather had paralysis, and her uncle fits mother skin disease. Investigation reports I will show you bilateral tubal cornu block. So cornu block is always very difficult to clear. Okay. So this is really difficult, and both the sides were blocked, and in ultrasound we find PCOD. This is the hormone reports what she had done. Prolactin was quite normal. Insulin was also 3.41, very normal. And her husband's seminal fluid analysis was nearly normal, but RBC was there, 2 to 3 high power field. I advised him to go for seminal analysis, and he brought me this report. And this RBC gradually was cleared with arnica. I had given him arnica and along with nucleotium mother tincture. So with this, he was cured. And the lady had anti-AMH was 2.62, which was satisfactory in fertility. But this result report, hysterosalpingography had, you can mark that none of the tubes filled, neither any spillage seen due to cornu block, bilateral cornu block. None of the tubes were filled with dye, and neither any dye spillage seen in the case. Ultrasound bilateral polycystic ovaries we found in the ultrasound. And I went with the reportization that I took the rubrics like female genitalia, sterility, female genitalia. I had taken the abortion, recurrent abortion, and female genitalia tumor, ovary, cyst, like that, and the another female genitalia inflammation, oviduct, the fallopian tube block, was due to the chronic salpingitis. Please 1 minute. Please. Webinar 9:30 ପରେ କଥା ହଉଛି. So the female genitalia in inflammation oviduct. We are taking this rubric for chronic salpingitis. And the chest pain mummy before menses, pain mummy during menses, a head pain after anger, head pain menses during, head pain from weeping, from excitement, and ailments from suppressed anger, so emotions suppressed, cowardice, opinion can't express, fear of strangers, sensitive to criticism and sensitive to opinion of others. So with this, I had taken 16 rubrics, and the total marks by Natramur covered the 10 rubrics, getting 19 marks, and Staphysagria 9 rubrics got 19 marks. So in this case, I went for the Natramur due to constitution of these things. So Natramur 1M once in 15 days with placebo 30 twice daily, and Echinacea Q also I had done 20 drops twice daily, thinking that there is infection. And after 2 months follow-up, headache improved but no pregnancy. I went with Natramur 10M 2 doses 1 hourly and plus ovaries 3x twice daily. And again after 2 months no pregnancy, so I left Natramur. The second drug in reporterization was Staphysagria. I went with Staphysagria 1M once in 15 days plus ovaries 3x. But still then no pregnancy. I went with the nosode, psychotic nosode Medrinum 10M, and I got really very good results with Medrinum 10M with many cases. So I went with that. This is a psychosyphilitic case. I went with Medrinum 10M 2 doses 1 hourly, and after 2 months again no pregnancy. Patient presented very good symptoms. She has visited the Puri in Odisha and to the seashore. So with that, she presented me that a headache was relieved after sea bathing. This is a symptom, and another symptom she told me, so very strong symptom, that the nausea and vomiting from eggs. So with this, I went for psychotic compound. This is a very good symptom of psychotic compound, that is nausea and vomiting from eggs. Okay. So here also we find Proteus is another drug, Teromet is also a drug. So after 2 months, the lady came with menses scanty only for 1 day, but no pregnancy. Okay. Again, I went with a Psychotico 1M, and after 20 days, she had missed periods when she went for the urine gravidex test, which was pregnancy positive. So this I went for again serum beta HCG, which was 8,846. This clarifies that this is pregnancy, because non-pregnancy less than 5 and it is strong positive. She is continuing with me now also, and this is the ultrasound report. Single viable intrauterine pregnancy, approximate gestational age 10 weeks, 1 day. So she brought me this report. Now she is continuing our medicines for any problem. I had gone with the double marker test, and I had consulted a fetal medicine gynecologist and sent her to consult her for the next ultrasonography, which will be about 20 weeks of pregnancy in this 10 days after, I think, for NT scan. So this is the bowel nosode. Already discussed all these things. Coming to Psychotico, here the Natramur, similar symptoms with the Psychotico we found censorious, both Natramur and they are very critical in their cut. So fear of dark, dogs, irritability, sensitiveness, timidity, weeping, all these things due to time is really short. Already we know all these things. Prostration in mind, sadness, aggravation, cold air and light, dark complexion, both. But dysenterico is very fair complexion. Psychotico is dark complexion. So in dysenterico we find nervous tension. Here we find irritability in synovial membranes and mucous membranes. In case of psychotic compound. So menses copious, painful, metrorrhagia, amenorrhea, perspiration at night during sleep, profuse perspiration, headache, constant headache before, during and after menses, accompanied by nausea. All these things we find in natramure and also with psychotic compound. Okay. Brittle nails, leukorrhea, excoriating leukorrhea. In both the cases, we find these two drugs. But what is the contrasting features? How the natramure differs from psychotico, that we will discuss now. That is, natramure is hot, susceptible to cold, but thermal reaction is hot. Psychotico, chilly, susceptible to cold. Anger at trifles, natramure, violent when consoled. Consolation aggravates in natramure. But in psychotico, we don't find that. Anger from indignation, we find just like our Staphysagra, like our anacardium, we find in psychotico anger from indignation. But that we won't find in case of natramure. Anger at trifles with taciturnity alternating with vivacity, we find in case of natramure. Okay. Fear of death, fear of insanity, fear of thunderstorm, fear of pupil, we find in natramure. But in psychotico, we find fear of being alone and fear of animals. Natramure loves to be alone, no fear. But in psychotico, we find fear of being alone and fear of animals. Natramure allergic to chemicals, psychotico allergic to detergents. This is also a very good symptom we find in case of psychotico. In skin conditions, the cracked phelons, the chilblains, the cracks on the palms. I had seen allergic to these detergents, just like sepia, agaricus, we have drugs. So just like that, in case of psychotico also, we find this symptom. And desire for bitter, brandy, bread, chocolate, we find in case of natramure. And here, psychotico, we find desire for butter and rich food. Aversion to warm drinks, slimy food. Here, in psychotico, aversion to potato, pudding, tea, all these things. And intolerance to salt, we find in case of natramure, even aggravation from salt. And milk intolerance. Here in psychotico, we find orange intolerance. So coming to psychotico study, we find the keynote is irritability in special reference to mucous membranes and synovial membranes. Mucous membranes that might be of the respiratory tract, might be of the mouth. In buccal mucosa, we find aphthous, we find tongue ulcers in case of psychotico, and in gastric symptoms, we in respiratory tract, in urinary tract, in the genital system, and in relation to synovial membranes, we find joints. In joint, psychotic compound is a very, very good drug. So coming to constitution, tubercular constitution, we find here, and very anemic. Patterson has written that psychotic patient is always anemic looking, never carries much color. Okay. So, pale, dark. And again, Patterson has written that I regard psychotic compounds as a pre-tubercular remedy. Okay. That's why I think in that case, the bilateral cornu block Usually chronic salpingitis, the adhesion, we find psychosyphilitic. In hydrosalpinx, this is syphilitic. So the cornoblock might be the pre-tubercular condition. That's why the psychotic compound acted very well in that case. Coming to mental, in both physical irritability and mental irritability we find in case of psychotic compound. It is irritable, nervous, cross, very tense and restlessness also we find very much marked, just like Rostux. A similar drug is Rostux to psychotic compound. And in many cases I have seen with the Rostux symptoms, when Rostux fails, in that case I had gone for psychotic compound with very good result in case of knee arthritis. Knee arthritis, I had found very good result with the psychotic compound. And irritable when excited, as like just like argentum nitricum, twitching of facial muscles, blinking of lids after taking egg. So egg is always intolerance and a aggravating factor in psychotic compound. Fear of being alone, darkness, animals, fear of dogs, just like tuberculinum, pulsatilla, we find here also. Tearful, timid, fussy, bites nails. Okay. And very fussy means very much keen in small things. Very much, this is not exactly fastidious, but in order, we can think that we always complaining nature like that. Hypersensitive and depressed, exhausted, prostration is great. Prostration we find in case of psychotic compound, and sudden anger from indignation. This also we find in psychotic compound. Coming to physical generals, the thermal reaction in chili already discussed. Desire for butter, sweets, rich food, and aversion to egg, milk, fat things like that. And intolerance egg, already I had discussed that this symptom is a very good symptom, very reliable symptom, causes nausea and vomiting. Even thought of the egg causes nausea in morning hours. That is a psychotic compound. Rectum diarrhea alternates with constipation. We have many drugs, but here also we find this. Another symptom I will say, sudden urging in morning. Sudden urging in morning, we have sulfur, natrum salt, bryonia, rheumates like drugs. But psychotic compound helped me in a case of IBS, basing upon this symptom, that in case of sulfur we find that the urge wakes him her up. The urge for stool, for passing stool, wakes him up in case of sulfur. But in case of natrum salt, bryonia is like psychotico, that is immediately after getting up, after rising up, when she rises up from the bed, when she stands, immediately it is psychotico. It is only psychotico. This single remedy in our synthesis repertory, that is the rising up morning, after rising up immediately we will find psychotic compound. And basing upon this symptom and nausea and vomiting after egg, with the IBS patient was cured with a psychotic compound. Now IBS is usually dysentery, but basing upon this symptom I went for psychotico, and she was cured from very difficult condition, that is irritable bowel syndrome. But in case of bryonia and natrum salt, we find she gets up from the bed, stands, and after 2, 3, 4, 5 minutes, the urge comes and she goes to the closet to pass stool. Okay, so that is the differentiating feature in case of stool from psychotico to other drugs. In thuja, we find breakfast diarrhea, diarrhea after breakfast, in morning hours, but after food. And this stool crumbles when passed. This also we find in Thuja, Natramur, Amonmur, Magmur, like that. Prolapse of rectum, perianal wards we find in Psychotico, like Cinnabaris, natric acid, Thuja, natrum salt. In urine, we find frequent painful micturition with sudden urge, urine strong smelling, corrosive, albuminuria, menses amenorrhea, dysmenorrhea. All these conditions we find in case of psychotic. Sleep is very restless sleep. Really, in aggravation time, this is a very peculiar symptom. We find in case of, am I audible to you? Hello, am I audible?
Yes. Yes.
Yes.
Okay, thank you. So, really we had a very long time rain, heavy rain today for 3-4 hours. And after that, the internet connection is becoming unstable. Okay. So we had a very good, very aggravation period here we have. That is 2 a.m. to 3 a.m. we find in case of psychotico, just like Thuja aggravation 3 a.m. and in 2 a.m. to 3 a.m. all Kali group drugs, Kali's 2 a.m. to 4 a.m. aggravation. Here also we find the patient, the person can't sleep after 3 a.m. It is very difficult, very restlessness he feels, and alone, can't sleep alone also, very restless sleep. So insomnia frequently we find in case of psychotico, and dreams of dead people, sweats profuse during sleep from head and body. The psychotico is usually a left-sided drug, just like Thuja, and facial neuralgia, headache, everything you will find in left-sided in case of psychotic compound. Another very important symptom we find in skin symptoms, that is unusual hairs on face and upper lip. This hello.
It's okay, doctor. Some disturbance. No problem. You can proceed.
Okay. So we find really in polycystic ovarian syndrome cases where the testosterone level is more, the androgen level is more in female cases. In those cases, due to hyperandrogenemia, we find unusual hairs on face and upper lip, usually associated with infertility. I have seen in many cases. Natramur, Cipia, Pulsatilla, tuberculinum are very, very good drugs in those cases. But I will say that Psychotico is also a good, very good drug in these conditions for hyperandrogenemia, unusual hairs on face and upper lip. And it has also the symptoms like premature gray hairs, hair fall, all these things. Coming to aggravation modalities, we find aggravation just like hydrogenoid to some extent constitution like Thuja. We find in case of psychotic compound, tubercular drug, but some cases we find the Thuja like constitution, and but Thuja is obese. Here we find lenity. Why I told hydrogenoid, the cold and damp weather and the frost, all these things are aggravating factors. Where just like Thuja in bronchial asthma and bronchitis, the respiratory complaints are aggravated from cold, damp weather. Excitement, aggravation from excitement and detergents, we find palmar dermatitis. What I had told you, and I have relied upon much more on Psychotico for this palmar dermatitis due to detergents in ladies. Skin troubles are aggravated by heat, and the headache is aggravated before, during, and after menses. Oh, left ovarian pain also we find in case of psychotico, just like our lachesis, we find in xanthogylum, and the left-sided ovarian neuralgia, very good drugs. And morning aggravation, we find catarrh, flu, stool, and cough. Rheumatic troubles, just like Rostox, just like natron salt, we find natron salt also we find morning aggravation, and fast motion aggravation we find in rheumatic troubles, skin disorders, and wheeze or cough is aggravated 2 to 3 a.m. just like Calis, Amon group drugs, and our Fusa also. Rheumatic complaints are aggravated by sitting. Bronchitis is aggravation in winter aggravation. We find in causticum, hippursul, Nux vomica, Amon group, Amon carb specifically I have seen. And so winter aggravation. Aconite also definitely. So headache is aggravation by noise. And gastric troubles are aggravation by egg. What I have found, fat and egg. Amelioration, pain in finger joints in daytime, relief. Rheumatic pains are relieved in motion. Rheumatic troubles, a headache, relieved by heat. Just like our natrum salt, Fusa, Rostox. These drugs also we find this. Headache is relieved by rest, and bronchial asthma relieved in seaside. Coming to the clinical conditions, this is very important really. What already we had discussed, in mouth we find apathy, anemia, in headache we find migraine like headache, and the headache continues for some days, might be for a week, and weekly episode we find just like arsenic, China, cedron, we find here also in psychotico. The weekly episode, and alopecia we find in psychotico. Puffy face in morning under eyelids, we find this is a good drug. Malignant growth on right cheek, psychotico can be thought of for cancerous conditions also. In cancerous conditions we find that might be in cancer breast after mastectomy. If some symptoms, the symptoms of psychotico is there, we can think of psychotico. And in the right cheek, if there is a growth, malignant growth, there also we can find if the other symptoms match, then we can find psychotico is a good drug. Left-sided facial neuralgia, left-sided already I had discussed. But I have seen in my practice, Spigelia, lachesis, Verbascum are very good drugs for left-sided prosopalgia, facial neuralgia. Chronic nasal catarrh, epistaxis, recurrent tonsillitis, goiter, sinusitis, otorrhea, deafness, and we find recurrent tonsillitis, enlarged adenoids, enlarged tonsils also we find psychotico is a very good drug. But I have found in eczema, chilblains, I have seen very good effect, and I have found very good effect in the infertility, salpingitis, ovarian cyst, menorrhagia also, and the best results I found with the finger arthritis. Arthritis of the fingers, nodules, and rheumatism of the knee, stiffness. Stiffness, aggravation from cold, aggravation in morning, relieved by motion. I have, after Rostox, I went with a psychotico many times, and I found very good results. Sore ankles and sore soles, aggravation at night, and cracked skin, itching vesicles from detergents. I have found very good results from detergents, And flat warts on hands, just like anacardium, dulcamara. Here also we find Psychotico is a good drug, and eczema back of the hands also. In male sex also this has very good effect in testicular tumors, impotency. So these are the clinical conditions where we can go for huge range of action in every system. Neuralgia also we find very good effect. And I told you that the most prototype drug is Thuja accidentalis. So coming, what are the similar features? Let's discuss Thuja and Psychotico. These similar features are both are fastidious to some extent, not like arsenical, not like carcinosin. They are the first grade drugs, but to some extent Psychotico and Thuja are fastidious. Thermal reaction, chilly, both the drugs are chilly, wet weather aggravation, cold, damp, working with water, long time aggravates in both the cases. Desire for salt and sweet, aversion to meat, potato, tea, vegetables, intolerance to fat, smell of food, onion, we find in case of Psychotico, and dreams of the death and dreams of dead bodies we find in Psychotico. Perspiration during sleep we find in case of psychotic compound. And hair falling hair, I discussed already, gray hair, hair fall, growth of hair in upper lips in women. We find both Thuja, and Thuja is also a very good drug. And Psychotico, smell acute of cooking food. We find both the drugs. Nausea during cough from smell of food. We find both in Psychotico and Thuja. Diarrhea in morning from excitement, emotion, splinter-like pain in rectum. See, this is a symptom of from excitement, emotion, diarrhea. All these symptoms we find in nitric acid and in Thuja and Psychotico. Headache before and after menses we find in sepia also this symptom, natramine, sepia, pulsatilla, many more drugs are there. Pain in the left ovary during menses we find in case of Psychotico. Skin of feet cracked, nails brittle, paronychia affecting nails, chilblains affecting feet, restless feet at night, and warts, flat warts we find in case both the cases, and Psychotico. So what are the contrasting features? Let's see. In Thuja we find anger from contradiction, and Psychotico we find anger from indignation. In Thuja we find fear of strangers, misfortune, fear of being alone, and fear of darkness. In Thuja we find irritability with complaints of a headache associated with irritability, just like natramine, Holocene, and in Psycho. Okay. And in Thuja we find desire for cold drinks, chocolate, cold food, raw onion. And in Psychotico we find desire. In Thuja we find aversion to garlic, and Psychotico aversion to egg, fat, milk products, vinegar, bread, tomato. So all these things we find. Nausea after smoking we find in case of Thuja, and a Psychotico nausea after taking eggs. A very good symptom, which has indicated for Psychotico, and the lady becomes fertile.
Some network problem, I think.
I think so.
Psychotico. So this is mostly all about Psychotico. We can differentiate, find out the similar symptoms and differences from natrum salt, from Rostox, from antimatter, from calcarea. So like this, we can also find out the similar and the. So this is time is over. Thank thank you everyone for patient hearing. Any questions?
Thank you so much, madam. Really, it is a wonderful session, and I truly appreciate your simplicity of sharing the things. Normally, those who have big knowledge, I mean, great knowledge, they are more humble. You proved it that. Okay, Dr. Beatrix, you can ask the question.
Yes, thank you very much. First of all, it was really, really very interesting session. And I also admire your case. And I also did like very much your complete materia medica. And I have to say that I also discovered the bowel remedies in my clinic. I'm talking at the moment from Germany. So thank you very much for that information. My question is concerning your case. So it was very interesting. You started with natrium muriaticum, later meduorinum. At the end with psychotic, it was successful.
Hello.
When the woman got pregnant
Hello.
after psychotic 1M, did you continue with any medication? I did not understand that passage.
Can you?
Again, please,
the question?
madam. I can't hear.
Can you repeat the question, Dr. Beatrix?
Yes, no problem.
Hello.
Your patient, when she got pregnant after
Hello.
psychotic 1M, did you go on with
Yes,
some
yes, yes, yes.
medication?
Please repeat.
Now you can hear me? Now?
Madam, do one thing. Can you please close your screen share?
Please. Because
There.
due to heavy rain, the power cut is there and the internet connection is very unstable here.
Okay. Okay.
So please write down the question in chat box.
Okay, then okay. Can you? Okay.
Okay, now you can hear us? Can you hear us?
Yes, yes. It is audible.
Okay, very good. So last question. Did you give any medication to that patient after getting pregnant? After psychotic 1M, she got pregnant.
Yes, madam. See, now also. So now also I am continuing with psychotic 1M in diluted doses. I am adding one dose to 100 ml distilled water and saying her to give 10 uniform strokes and to take 1 teaspoonful every day. Okay. Throughout pregnancy, I will continue.
Very interesting.
Is having that also I will add some medicine, acute medicine along with this to control those conditions. If when really she had bleeding for vagina for 4-5 weeks after getting pregnant, and I had continued arnica 200 in fractional doses to take 1 teaspoonful thrice daily, and along with that I had given some vitamin C and to her to control bleeding, and with that the bleeding was controlled. Okay. With arnica. Continue with me up to labor. Really, madam, I had seen already near about 3,000 pregnancy cases, and I am continuing with constitutional remedy from the physical generals, mental generals throughout pregnancy. I am not stopping that, and along with that, I give the symptoms based to control the acute conditions. I give the symptoms indicate which remedy I add to that in that condition, and when the acute symptoms disappear, I stop those acute remedies and continue with the constitutional remedy. Along with
Thank you
that,
so
I
much.
give iron, I give calcium, I give the ferrum phos if indicated. Sometimes I give caliphos towards last weeks of gestation. So with this, I am continuing, and I go for regular monthly antenatal checkup. I do that, and along with all blood investigations, all ultrasound sounds. As this is
Thank
a risk pregnancy,
Thank you,
I
madam.
referred
Now,
her to a fetal medicine doctor only for ultrasound, not for treatment. Okay.
thank you so much, madam. Now it is the time for the Malayalam session.
Hello.
Really wonderful session. It was the
Yes,
knowledge you have shared is
thank
full
you.
of wisdom.
Yes.
Okay, thank you.
Thank you
Thank
so
you.
much. And now I am inviting Dr.
I
P.
think
Shaila.
your doubt is clear, madam.
Yes, clear. And now it is the end of the English session. I am inviting, thank you so much, doctor. And now I am inviting Dr. Shaila for
Thank you,
moderating
thank you.
Malayalam session. Good night, everyone.
there
We are
is-
moving to Malayalam session.
There is an announcement for tomorrow. Tomorrow
Okay.
we will have a session from Dr. Mukanta Singh, and doctor will be talking about fainting and homeopathic perspective. Thank you.
Okay. Dr. Shaila, over to you.